All right, before we go to this next story, just a warning that some of you might find the subject matter and the images that we show distressing. Around the world, hundreds of thousands of people with mental health conditions are still literally being chained up, sometimes for months on end. A report by Human Rights Watch details how the troubling practice of shackling is still used in around 60 countries. I'm joined by the author of the report, Senior Disability Researcher at Human Rights Watch, Kriti Sharma in Jakarta. Kriti, appreciate your time. This is such a tricky topic to discuss, but so heartbreaking in many respects. Just how widespread is the use of shackles?
Shackling is a widespread, brutal practice that is an open secret in many countries across Asia, Africa, the Middle East, and Latin America, as well as Europe. We found men, women, and children, some as young as 10, being chained to trees, locked in sheds, or even sometimes in cages for years at a time.
Kriti, is this a lack of understanding about mental health or a lack of mental health support facilities?
It's both. Families are struggling to cope. There's so much stigma in communities and lack of awareness where people believe that mental health conditions are the result of having sinned or being bewitched. And there are simply no services. Governments today are failing to provide mental health support in many communities.
How, in your research, does it further impact a person's mental health?
You have to imagine someone is chained in a radius of 1 to 2 meters square. That's the radius of their lives. They are forced to eat, sleep, urinate, defecate in that space, sometimes for years. It's deeply traumatizing. It also causes a number of health issues. Your muscles can atrophy. It can prevent you from even standing up. And of course, you're prone to infections. This can be a very serious threat, especially in a COVID-19 era, and we are seeing that.
So let's talk about the COVID-19 pandemic that we're going through. Has it increased the use of shackling?
People who are shackled live in extremely unsanitary conditions. They are locked in chains right next to other people, so physical distancing is impossible. They don't have access to soap, water, proper sanitation, which poses an extreme risk with COVID-19. We are seeing cases where people who were free are now going back to chains. One man, Sodikin, who I had met in 2014, he had been locked up in a shed outside his family home for 8 years. He was finally released when he got mental health support. He spent 4 years in the community, holding down a job. He did the local call to prayer at his mosque. He was thriving until COVID-19 hit, and now he's in shackles again.
Kriti, does it open up the possibility of abuse in other ways as well, both physical and sexual?
Absolutely. We have documented a number of cases where people who are locked in institutions are forced to fast, sometimes deprived of food for a week at a time, subjected to physical and sexual violence. In countries like Nigeria, Kenya, Indonesia, we find that they have scars years later from places where they were shackled. And for women, it's extremely, it exposes them to sexual violence, being chained next to a man right next to them, and they can't run away.
You, of course, are talking to us from Jakarta. Indonesia have tried to stop the practice. Have they succeeded? Have they made any inroads into trying to reduce the numbers of people who have to be shackled in this way?
The Indonesian government had banned shackling in 1977. And yet today, thousands remain in chains. There have been a number of positive steps. The government launched its own campaign to end the practice. They now have a community-based health program which provides services to 48 million households. But even this program has been suspended under COVID-19, and people are going back to living in chains.
So what are your recommendations and how do you begin to tackle a problem this big in very disparate countries, somewhere you've got a real sort of obstacle when it comes to financials, resources and even education about these kind of issues?
That's why we're launching a hashtag Break the Chains campaign, calling on governments to ban shackling, provide mental health and other support services in communities, including housing, education, employment, and thirdly, to really combat stigma head on, because that's really the root cause.
And I can only imagine that the chance of recovery must be so much lower given this kind of practice.
Absolutely. It's, I've met so many people who have been chained for years, and it takes them, they have incredible resilience to try to reintegrate community, but it's very, very hard, and it's a trauma that some of them never get over.
Kriti, I really appreciate you joining us. I know a difficult topic. Thank you very much for bringing it to our attention.
Thank you.